Therapy is a treatment. If you check the dictionary, it says treatment intended to relieve or heal. Now, treatment can range from anything to taking a paracetamol for your headache to surgery. Physiotherapy is another kind of therapy, but for your muscles. Psychotherapy would be your therapy for mental health. Within the therapies that exist for your mental health, there are many types and they're called modalities. Cognitive therapy is where you use your thoughts to affect your behaviors and your feelings. Behavioral therapy is where you use your behaviors to affect your thoughts and your feelings. And cognitive behavioral therapy is when you use your thoughts and your behaviors to make the change. There are many other modalities, arts-based, body-based, psychodynamic, narrative, but we're not going to cover them in this video. You want to choose a modality that is evidence-based and resonates with you. Evidence-based means that the theory and the design of this treatment has been tried out and experimented on with people and has shown positive results. There's a list of evidence-based therapies in the description below, and we're also leaving you with a resource called Psychology Today. Please note this is an American website and things in India are a little bit different, but if you're on some website and you're going through all of these names of modalities and you're like, then Psychology Today is a good place to get an overview of all the different types of modalities. Most evidence-based therapies work on all sorts of problems and struggles unless specifically mentioned otherwise. But here's the main thing. Usually it's more important that you feel a connection with your therapist rather than one modality over another. When you're not feeling so good, it can be exhausting and annoying to try and figure out these new things and make a choice about this. You don't have to know about the modality to pick it, and you don't have to know about the modality for it to work for you and help you. You can also ask the therapist at any point what the modality they're using is and how it works. It's their responsibility to explain it to you. And if they're not able to do that, then it's on them and not on you. You'll notice that a lot of therapies are pretty similar, but they have different names. Because someone came up with a design, did things a little bit differently, tested it, it worked, and now they had to call it something. So the first time I heard mindfulness-based therapy, I was like, all therapy is supposed to be mindful. Or emotionally focused therapy. I was like, all therapy at some point will focus on your emotions. So don't get thrown off by the names. Read as much as you can and as much as you want to. The most important thing, if you take away one thing from this video, remember, pick an evidence-based therapy with a therapist who you feel comfortable with and who you connect with. Happy therapying!